On a typical day, one can interact with hundreds of people. If any one of these people carries a disease such as measles, it will be rapidly spread across a network of interacting citizens, possibly resulting in an outbreak. Doctors' offices become flooded, people panic, and the community has to stop its routine to fix this untimely issue. What if I told you that this problem had a simple solution? The first developments of vaccines occurred over 200 years ago, beginning a great revolution for the medical field. Today in America, vaccines save 42,000 lives annually. That's 3 times more than seatbelts save. However, the number of unvaccinated and undervaccinated children in America is rising exponentially, and the decision not to vaccinate affects more people than you may think. Today, I will be using the Rotary 4-way test to reveal the ethical flaws behind the anti-vaccination movement. First, we ask, is it the truth? An examination of the facts shows that this moral dilemma is real, relevant, and roaring. Currently, there are no federal laws mandating vaccines for children. However, states have vaccination laws for children enrolling in public schools. This legal system leaves about 3% of children unvaccinated. A common misconception regarding vaccines is that unvaccinated people pose no risk to vaccinated people. The truth is that even with vaccines, our immune systems inevitably weaken with age, and many people become vulnerable to disease outbreaks. Furthermore, when an epidemic rises, treatments occur in the same spaces where immunosuppressed people are receiving treatment. In other words, our most defenseless individuals and our most dangerous individuals are being combined in a disease diffusion disaster. To top it all off, this problem is growing. The number of completely unvaccinated children under age 2 in the United States has quadrupled since 2001, rising from 0.3% to 1.3%. Overall, the anti-vaccination movement is the sad truth, and it has terrible consequences. Second, we ask, is it fair to all concerned? Well, if I may answer a question with another question, is it fair for a group of people to knowingly put another in danger? Parents all want the best for their children, but these parents are in fact jeopardizing the lives of their children and others. Many unvaccinated people believe they are safe because of herd immunity, or the concept that unvaccinated people are protected by vaccinated people within a community. People who choose not to vaccinate are reaping the benefits of vaccination through herd immunity while endangering the lives of others. Although they could do their part in preventing disease, they choose not to, which is certainly not fair. This situation leads to unnecessary stress and worry among people, distracting them from being their best selves. Therefore, denying vaccines leads to a situation that is unfair to all and morally wrong. Next, we will explore whether or not these actions promote goodwill and better friendships. Vaccines prevent a myriad of illnesses and diseases, allowing children and adults to attend school, jobs, and other social functions. Without them, people sometimes have to put their lives on pause to fix an issue that was preventable in the first place, allowing for less connectivity in a community. People with immune system disorders attend my high school, and any exposure to disease could hospitalize them. They are able to come to school, make friends, and live normal lives thanks to vaccines and other measures. Unvaccinated and undervaccinated people within a community prevent this social connectivity, so they do not promote goodwill or better friendships. In order to determine whether or not this practice is beneficial to all concerned, we must define who is concerned in the first place. First, let's consider the unvaccinated children themselves. They are at greatest risk of becoming ill. In the event of an outbreak, they are rushed to the nearest hospital, and just a few feet away are other patients. Nearly all of these patients have some level of a weakened immune system during their stay, and this family has just exposed an entire hospital of those most vulnerable to germs. As a volunteer at Fox Chase Cancer Center, I have worked with many immunocompromised patients. These patients have enough battles to fight. The last thing they need is another health risk, especially one that was preventable in the first place. Going back to our story, after the child returns to the outside world, they will continue to interact with other people. Many diseases are contagious before symptoms occur, which is dangerous because of the highly social world we live in. In just a few days, an entire city can be affected. Clearly, this avoidable domino effect does not benefit anyone concerned when it comes to the anti-vaccination movement. In summary, the Rotarian way of thinking properly calls out the flaws in choosing not to vaccinate children. This behavior does not pass the four-way test. We hold in our hands the power to educate others. I hope you will use that power to make a difference in the world. It is said that a chain is only as strong as its weakest link, and the anti-vaccination movement is a problem that we must work to solve.